Hurricane Harvey had a devastating impact on Houston and all of Southeast Texas. More than 1 million Texans were impacted. Many lost their homes, transportation, and more. The hardest hit Houstonians were those that were living in poverty or on the brink. Those are exactly the patients that we see at San Jose Clinic every day. Many others are in situations that will remain extremely precarious in the coming weeks, months, and years.
My name is Stephanie Estrada. My husband is Jose Estrada, and my daughter's name is Genesis. We moved to Katy because it doesn't get flooded over here, so. But just in case, my husband's like, let's pack, a luggage. So we have a little puppy. His name is Pluto. He was 5 months at the time. So he jumped off the bed and he felt the water. He was like, barking everywhere. And that's how we found out. We all woke up, and when my husband put his feet down, he felt the water was already to his ankles. So we were like, okay, we gotta go. I saw when the water was up to my ankles. I saw it when it's up to my knees. And now I'm seeing it all the way up here to my chest. It was just so sad to see yourself in the boat and see how your apartment was getting filled with water.
We waived our requirements for patients just like the Estradas. Their lives washed away so quickly, all of their hard work gone. Everyone deserves quality health care, and we are honored to provide it to so many people during this recovery.
Timing is everything. San Jose Clinic wasted no time. Not only did we open our doors, we're already kind of set up to handle patients in crisis, patients in need. And so it was almost just second nature. It was just very simple for us to transition into being a charity clinic over to relief.
The staff and volunteers at San Jose Clinic have been working hard to respond to the medical needs of the community for 95 years. It seemed most appropriate for us to expand this compassion to those in need post-Harvey.
Right off the bat, our operations team made critical changes that I think were very valuable to our patients, keeping in mind that a lot of them did not even have their documents because they left their homes.
Just evacuate so quick that I had forgotten my purse downstairs, and he had forgotten his medicine. So the water was like all the way up to his chest, and he just went to go get my purse. He couldn't even see it because everything was underwater, and he felt the key, so he had gotten it, but he forgot his medicine because he has diabetes. He has to take 2 pills a day, which helps him control his sugar.
These are medications that if these patients went without them, they'd end up in the emergency room.
In just a matter of weeks, San Jose Clinic provided 3,000 patient visits and filled more than 2,500 prescriptions, medication refills, eye exams, eyeglasses, tetanus shots, emergency dental care, first aid, primary and specialty care. We also made sure we focused on mental health and trauma, grief, loss, healing. In the wake of a disaster, this is important.
Patient care goes so much further than just medications and disease diagnosis. It's that culture that we've built amongst our patients that really heals them.
Nearly 60% of low-income adults in Harris County are uninsured, even though most of these people are employed, much like the majority of our patients who live at or below the federal poverty line.
I'm a nanny, so I'm a full-time nanny. My husband, so he works in construction, so we don't have insurance. After the hurricane, he had gotten very bad toothache. Then we came over here. We came and he was just in pain, so much pain. And we were like, can you help us? And she was like, yes, we're helping. They treated him the first day we came here.
This was a time where a lot of patients had a lot of uncertainties in their lives. And so to have one thing be so certain for them, like San Jose Clinic, was critical.
I thank God that this place was here to help us.
Responding to the call from the communities, we were able to set up satellite clinics for the underserved, our volunteer corps, our partners at AmeriCares and Direct Relief, and made new friends with Project Hope, welcoming volunteers from around the world.
Everybody was really accommodating, so we were able to go and set up our satellite locations there. Tremendous support of the community, the tremendous support of people everywhere. That's something that you don't see everywhere.
Even though we've been through so much bad, it's just we've seen more good out of that bad.
San Jose Clinic will remain available to the area and to the vulnerable population as they recover and try to rebuild their lives. San Jose Clinic could not do this without your help.
If it wasn't for faithful and generous supporters like you, Project Hope, organization as Project Hope and San Jose Clinic would not exist. Thank you for supporting us. Thank you for helping us to help to the people that are needed the most.
I would like to thank all of our supporters for investing in us and trusting us with the mission of San Jose Clinic to provide patient care.
Your money's not going to waste. Your money is going to a good cause. It's helping me as my family is trying to get back on our feet. It's helping so many other people. They're getting treatment and everything because of this clinic. I want to thank you all. If I could see you guys and give you a hug, I would give everybody a hug and say thank you so much for everything. This clinic has been a blessing to me and my family. And I know that it has been a blessing to everybody who comes here. Thank you so much, and may God bless you guys.